Welcome back to Ebling and You, Dr. Shah and Dr. Borracio, cardiologist, psychologist, kind of mixing it up here in a good way. And actually, just based on what we just heard, this might be a good time for you, Dr. Shah, you might just want to talk here a little bit about CPR, then we can get into anxiety, which is a huge area, but why don't you maybe explain to folks what it is, why it's important, and this type of thing, which could be helpful to our listeners.
Well, the way I put it is that when your family member has cardiac arrest, that probably is going to turn out to be the most anxious moment of your life. So anxiety and CPR really fits involved together. I'll be very anxious if my wife needs CPR. So yes, I realized over the last 25 years of doing this cardiology that even though we're going to try our best, all of us, patients, myself, society, hospitals, insurance companies, as we get old, one day cardiac arrest is just going to happen. It's inevitable because every person who is born is going to have cardiac arrest one day. So if we are prepared as a society to deal with cardiac arrest on a timely manner, I think we're going to be just a better society. The time has come for that. And we have proof. Matter of fact, in Seattle, if a person has a cardiac arrest, there's about 40% chance of making through. In Lansing, it's 5%. And I think we are as good, if not better than Seattle. I know that. I've been here for 15 years. So we need to now start a community-based movement, I call it. A grassroots movement where people take charge. Not the doctors, not American Heart, not Red Cross, not the government. People take charge. And they say they want to learn CPR for their own benefit, their family benefit. And once we have that going, believe me, nobody can stop us.
So that it is true. Don't we regularly hear of people? I'd say every week, every couple of weeks, somebody's in saying a person just died totally unexpectedly. 40, 50, 60, whatever it might be. And you never know if you might not have been able to save that person. I know a friend of mine actually happened to have a heart attack right in front of the hospital here in Lansing, by the way, and that's the reason that he lived. But he had missed, again, had been doing everything wrong and figuring everybody in my family lives to be 70. But his wife didn't know how to do CPR, I might add. He just happened to have the fortune of being, next to a hospital. So I do think, who could really argue with the point that the more people that can do CPR, the more helpful that can be. And I do know you're actually involved in that, actually.
Yeah, I think the fortunate part, Dr. Borracio, is that 10 years back, the CPR was considered like a major skill you have to go through to learn. I mean, 6 hours of training, a lot of money to spend. Over the time, we have realized as physicians and just as a medical community that to save a life, what we need is a simple chest compressions and periodic breathing. So now we pretty much have come down to teaching CPR, believe me or not, Dr. Borracio, in 22 minutes, and you can spend $25 through American Heart Association and learn CPR. Now that CPR is typically you learn for your friends and your family. This is not a medical quote-unquote CPR, but the effectiveness for that one person, the one you're going to save, is exactly the same. As a matter of fact, if anyone wants to learn CPR at our office, it's for $5. So we teach them exactly the same CPR what American Heart Association will teach you. We teach for $5 because I think, to me, it's a great feeling that what community has done for my practice and for myself and for my employees. We need to give community back. I think if we have a good community, it can back to economy, Dr. Borracio. If our mid-Michigan is not just healthy, but healthy in terms of economy, eventually we all are going to survive. I think it kind of feeds into each other. If you have healthy people, if you have people who work hard, if you have healthy companies, if you have healthy physicians, healthy psychologists with good mind, we all going to be happy. But until we do that, we cannot just stop.
Well, the good Roman Catholic in me says, amen. How does that sound? A positive way?
I always say amen.
Well, now I'm thinking the good Dr. Shah maybe ought to go into the ministry. I like that. It's good evangelization. I say that in a positive way. And I think what he's saying is very true in terms of the CPR, in terms of trying to help people. Anything we can do to help people live longer, helping them live better. It's, again, the think prevention, live long. I think that's really an important point.